Good morning. I'm Dr. John Volpi, the director of the Houston Methodist Eddie Skurlock Stroke Center and the course director for today's program. Thank you for joining us for today's event and bearing with us during some technical issues this morning. Today's event is Stroke 360, and I want to say a special thank you to Dr. Kent for kicking off the broadcast with an excellent basic science review of microbleeds and its relevance to cognitive decline. Dr. Kent is a professor of neurology at Texas A&M Medical School in Houston. We do have a packed program for today, and I hope you'll be able to join us for the entire day. If you miss any sessions, we will offer this program as an on-demand series in the next few weeks on our CME website. And if you missed last year's event, The Future of Stroke, it's available now on demand on the CME website in its entirety. Today's seminar will be divided into 5 blocks, and our overall goal is to provide a real link between the challenges of today and the science of tomorrow. I think you'll find the lectures you hear today will be relevant to your day-to-day practice and provide you real-world insights into the care of stroke patients. Our first block will focus on neurorestoration, a field that's exploding in interest and discovery. Dr. David Chu, the founding director of the Eddie Skurlock Stroke Center and professor of neurology, will moderate the session, which will begin in just a moment. Our second block will focus on stroke prevention through novel tools, therapies, and a fuller understanding of the data that drives our decisions. This session will be moderated by Dr. Wamda Ahmed, the Neurocritical Care Services Director for Houston Methodist Sugar Land. After the second block, we have a lunch break, and then we'll resume with our keynote address from Dr. Joseph Broderick, the founding director of StrokeNet and professor of neurology at the University of Cincinnati Gardner Neuroscience Institute. Dr. Broderick will take live questions after his lecture, so please submit your questions via chat during that presentation. After our keynote address, we'll turn up the temperature in the studio with our 2 live debates on hot topics in stroke management. First, we'll debate whether patients with an obvious large vessel occlusion should go straight to thrombectomy or receive thrombolysis first, then go to thrombectomy. And second, we'll debate whether lobar bleeds are better off with surgery or medical management. After each debate, you, the audience, will vote and decide who is most persuasive in shaping your patient management of 2 example cases. For our fourth lecture block, we'll take a whole body view of stroke prevention in a session moderated by Dr. Tanu Garg, a vascular neurologist at Houston Methodist and the clerkship director for medical student education and neurology. Finally, in our last session, we'll explore the ethical issues in stroke care and hear directly from a patient about her journey. This session will be moderated by Dr. Shyam Panchal. Dr. Panchal trained at Vanderbilt in vascular neurology and is currently a hospital-based neurologist at Houston Methodist The Woodlands. So with such a packed agenda, I'll now turn it over to my mentor, colleague, and friend, Dr. David Chu.